News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you or a loved one has ever had a problem with alcohol or drugs, and maybe also a mental health problem like depression or anxiety or bipolar disorder, and you've wondered, is there any chance of recovery? We'd like you to watch our show today because that's what we're going to be talking about, is the help and the hope that's available for someone who has what's called a co-occurring or a dual disorder, someone who has both kinds of those problems. And we have a great guest today. Sharon Dollarhide from NAMS has joined us again. You might remember Sharon was here a couple of months ago where she was talking about mental health court. And this time Sharon, who's a licensed clinical social worker and also a licensed alcohol and drug counselor, and coordinates the dual disorders of the co-occurring disorders program at NAMS, is here to be our guest and share her years of experience and expertise with us. So Sharon, thanks so much for being here.
Thanks for having me, Tom.
Okay. So Sharon, I think the first thing that people probably want to know is if someone has an alcohol or a drug problem and a mental health issue, is there hope? Can they recover? Can they have a life?
Well, the real simple answer is yes, absolutely. I've been in this particular role for the past 4 years, and I can't tell you how many success stories that I've witnessed over that amount of time. People who have gone from the very depths and the throes of addiction and acute mental illness to not only restoring their lives, but recovering skills and abilities and going on to lead just a quality of life, having families, getting jobs, and living lives just like you and I.
Yeah. Well, that's some great news, Sharon, that people are getting clean and sober and they're getting stable and then they're really recovering their lives. They're having a life from what I hear you say.
That's correct.
Yeah, it sounds like that's a goal of the work that you do in our community, Sharon, to help people get clean and sober and have a full life. Can you talk with us more about that?
Tom, what we do at Northern Nevada Adult Mental Health is identify people not only with a mental illness, but people who may suffer with a mental illness and a co-occurring substance abuse disorder. It used to be just a few short years ago that someone who did have a substance abuse disorder, who was struggling with that, we would send them off to another agency and only deal with the mental illness. And now we are tackling both best we can.
Yes. So Sharon, I guess could you go through maybe some of the drugs that people have been on and maybe some of the mental health disorders that they come to your program with?
Okay. Of course, in Northern Nevada, a real common drug is methamphetamine. Seems to be something that we still struggle with in Northern Nevada. Methamphetamine is a stimulant and in small amounts causes a person to have extra energy and focus and concentration. But in large amounts can cause disability, intoxication, and believe it or not, paranoia and psychosis. We also see a lot of people who struggle with alcoholism, probably the one that we deal with the most, and most people are familiar with that disorder. We also see a lot of marijuana abuse, and I'm always real cautious about that one, especially with young adults. Again, that can exacerbate or make worse an emerging mental illness in young adults. We also see a lot of prescription medication abuse, things like benzodiazepines, opiates, and stimulants like Ritalin. We see a lot of. Those are the major ones, although we do see cocaine, we do see heroin, we do see ecstasy, hallucinogens like LSD and mushrooms, so to some extent.
Yes, please go on.
And then the mental illnesses that we see are kind of like you mentioned at the top of the show. We see thought disorders like schizophrenia, schizoaffective disorder, and we also see a lot of mood disorders. Bipolar disorder, which people think of quite often as manic depression, is something that we deal with quite often. Anxiety, panic. We see a lot of people who've had trauma histories, abuse and neglect in their childhood, and a lot of people who've been involved in the criminal justice system. So we see a real wide variety of people struggling with not only mental illnesses, but with substance abuse disorders as well.
So Sharon, you have the Hearts program and you have the STARS program and of course a lot of other disciplines. Maybe right now, maybe you could tell us a little bit about the STARS program for people.
Okay. Northern Nevada Adult Mental Health started doing groups about 4 years ago on an outpatient basis, and it has eventually evolved into being called what we've named the group to be STARS, and it is an outpatient program. It operates 1 hour for each session, and we run 8 groups per week. Yes. So generally a person attends twice a week, and we will take a person however they come. If they're actively using, we do not discharge them, we do not send them away. We attempt to have a real accepting, welcoming, friendly, non-judgmental, non-confrontive attitude. We really want people to show up who are struggling.
And you know, that philosophy, Sharon, I know you've really developed that culture in the program, and we certainly want to hear more about that. After this brief break, we'll return and talk more with Sharon Dollahide about recovery. Hello and welcome back to New Skills for Living. We're talking about recovery from dual disorders with Sharon Dollahide, who is the coordinator of the Dual Disorders or Co-occurring Disorders program at Adult Mental Health. Sharon, you were beginning to tell us kind of the culture or the philosophy of the work that you and the counselors at NAMS, kind of the culture that you provide for people in recovery. Can you share more with us about that?
Sure. I think in order to maybe to tell you more about that, first I want to go back a little bit about the history of substance abuse treatment. I mean, I'm not going to give you a long one, but traditionally the way that we had approached substance abuse and mental health treatment was to provide separate treatment for separate disorders. And so quite frequently what would happen is a person would go to one agency for one type of treatment and another agency for mental health treatment. And very frequently, the two agencies never talked about the one person. So they were being really treated as if they were two different people. And it's really a rather new development in Northern Nevada. It's not really new around the country, but fairly new for our location, that what we do is what we call integrated treatment, which is attempting to treat both disorders in one place, preferably with one provider, so that the person gets a holistic, integrated approach to their treatment. So no longer do they have to talk about substance abuse in one place and mental health in another place. They can talk about both issues in one location and feel comfortable and accepted. So that is a real big change for the approach to treatment of people with co-occurring substance abuse and psychiatric disorders. And the treatment for these disorders is also different. It used to be that you would confront real hard a substance abuser and, you know, get to the core of the issue. And with a person with substance abuse and mental illness, you don't take that approach. Like I was telling you before, we attempt to be very welcoming, non-judgmental, and accept a person wherever they're at. If they're actively using, we accept them into the program. It used to be in traditional treatment, a person would be discharged from the program. When they're using, they're failing the treatment. Well, the way we look at it is if someone is actively using, that's when they're struggling the most, and that's when they need treatment the most.
Yeah.
So we accept a person who is struggling with those disorders. Something else that we also do is that we are, at the same time that we're working on abstinence, we are working on stabilizing the mental illness. And that is also a unique approach to treatment for these individuals.
Well, Sharon, I think probably a lot of our viewers are used to watching television shows where, they're up in somebody's face and you better do this. And what you're talking about is really more effective, isn't it? Being kind and gentle and accepting, and a person then kind of maybe feels safe.
Correct.
And they're able to be vulnerable and open up and talk about their problems and actually work through their problems rather than defending themselves, huh?
Yeah, that's correct. If you think about it, both disorders are very stigmatizing. A person feels very ashamed of having not only one, but both disorders. If you're a drug addict or an alcoholic, you're shamed by your family, by your community, by your workplace. And same thing is true if you have a mental illness. You're very shamed and stigmatized for that as well. So we try to lay those issues aside, explain to a person that these issues are not your fault. They are treatable and manageable. Unfortunately, at this point, not curable, but definitely they can be managed and treated, and we try to instill hope for individuals so that they can leave knowing that they are redeemable, they are manageable, and they are treatable disorders.
Well, Sharon, that was so nice to hear from you in this segment about creating a recovery environment where there's help and hope and acceptance, and people are getting better, and it's good to know we have such a great program in Northern Nevada. And we'll talk more about this with Sharon right after this brief break. Hello, and welcome back to New Skills for Living. We're talking with Sharon Dollarhide about recovery from dual disorders. And Sharon, one of the things I think you wanted to share with the community was about medications. Would you please go ahead and do that?
Sure. It's another fairly new development in the treatment of co-occurring disorders. Used to be when our clients would, for instance, show up to a self-help support group in the community, the old way would have been to say you need to take yourself off of all medications, all substances in order to be totally chemical free. And that is just not the case with a person with a co-occurring substance abuse and psychiatric disorder. What some people might be real surprised to learn is that while a person is in the process of getting clean and sober, we go ahead and treat the psychiatric symptoms with psychotropic medications. So I know it sounds strange, but if a person is drinking or using, they may actually be prescribed psych meds to stabilize the depression or the anxiety or whatever they're coping with. And if you think about it, it makes a lot of sense that if somebody decides to get clean and sober, they go ahead and get clean and sober, but in the next day or two or the next week or two, they have a recurrence of depression, symptoms of depression. And then they go to their doctor, get some medication. Well, the medications for depression don't really kick in for another 2 to 4 weeks. And by that time, someone will long have relapsed from the pain of suffering with depression. So we do prescribe medications in lieu of a person's active use. Obviously, there are some medications you cannot use when you're drinking or using.
And of course, Sharon, when you listen to people in recovery who are in recovery from a dual disorder, they'll tell us that they were self-medicating, that actually they were using the methamphetamine or the alcohol or the marijuana to kind of medicate their depression or their trauma or their schizophrenia. Isn't that right, Sharon?
That's very true, Tom.
Yeah.
What happens a lot of times is before someone is aware that they have a mental health diagnosis, they know they're feeling uncomfortable. They find a substance that makes them feel better, makes them feel happy, less stressed. allows them to escape for a while, and it's quite often what we call self-medicating. So a lot of people come to us stressed out, identifying that something's wrong, and all they know is they have a problem with addiction, come to find out that there's an underlying mental health issue as well.
In fact, Sharon, in this last minute, maybe you could share with us, what is the prevalence actually when we take a look? I mean, like a lot of the old timers in the 12-step programs or in the counseling field will say, it's been 20 years since I saw just a regular old alcoholic or drug addict. So can you tell us about the prevalence of the dual disorders?
Right. I don't have exact figures at Nevada Mental Health, but we think it's upwards of 70% of our 3,500 outpatients have a co-occurring substance abuse and psychiatric disorder. And we at Northern Nevada Adult Mental Health have come to expect a co-occurring substance abuse disorder rather than looking at it as an exception. So it is quite prevalent.
And I think that's really one of the great things that Sharon and her staff do at Adult Mental Health is by treating both disorders together and with psychiatrists and other professions, people are getting a chance, and their history of relapse is diminished. They get into recovery and stay there. And we'll talk more about this right after this brief break. Hello, and welcome back to New Skills for Living as we're talking with Sharon Dollarhide about recovery from dual disorders. And Sharon, one of the things that I've heard you mention is how important a good, thorough assessment is. Can you share with us what that looks like?
Sure, Tom. Actually, it takes quite a bit of detective work to take a look at somebody and uncover the very complicated issues that a person might be facing. On the surface, it oftentimes looks like just an addiction. Somebody's suffering with meth or alcohol dependence. But as we do an assessment, there are several things that we do in order to get a real good clinical picture. Obviously, we talk to the individual and find out what they're suffering with right now. If we listen very carefully, not only do we hear the addiction part, but we hear the depression, the anxiety, the paranoia, the mixed up thinking that they might be experiencing. We also ask about history. If there are times when you were ever clean and sober, what was your life like? Did you experience any stress, any depression, any periods of extreme energy and that kind of thing? So we have to be a sleuth in looking at not only the present symptoms that they're experiencing, but the past. We also work on getting them then clean and sober, working on abstinence, and at that point, after they've been abstinent for a period of good 3 months, then there are maybe other issues that emerged that were kind of hidden and that we didn't see. So consequently, the treatment is also very flexible. We might start in one place dealing with depression, only later to find out that a person actually has periods of, for instance, mania or high energy periods, and may readjust medications, and we may modify their treatment as we go along.
So that assessment process, of course, is so important. And Sharon, the other thing that's important is resources, huh?
Correct. We at Northern Nevada Adult Mental Health have adapted our service provision to address the issues that we see people struggling with. Like I said before, we offer the STARS outpatient groups. Generally about 2 times a week is how often a person attends. But for a person who is maybe struggling to get clean and sober and is still struggling with some mental health symptoms, we might refer them into our intensive outpatient program, which meets 5 days a week, 2.5 hours a day. That program is called HEARTS. Not only do we do relapse prevention and skill building, we also teach a person how to live a clean and sober life. So we do some skill building that way. There's also another program on our campus called CORE, which is also intensive outpatient. And that one is generally directed towards people who are more committed to their recovery and a little bit more stable with their symptoms. We also offer 12-step programming. It's called Dual Recovery Anonymous, or DRA, and that meets at our office on Fridays at noon. And that's for someone who enjoys a 12-step perspective, but also wants to feel comfortable talking about the psychiatric issues as well. They're allowed to talk about not only their addiction, but their mental health issues in that group as well.
So Sharon, for those people who might be watching and saying, gosh, I'd like to go to that program at NAMS, or I want to talk to my family member, maybe in like a half a minute, can you share with us, like, how can someone get into the programs?
Well, they could call our main switchboard number, 688-2001, and ask to speak with a professional, and we would be happy to kind of direct them that way. If a person is more inclined to get some help, all they need to do is come to our intake services at the D.E. Townsend Hospital on North Street in Sparks, and go through the intake process. It can take a little while to get through that whole process because you have to go through a psychosocial interview, a nursing assessment, and maybe be assessed for medications. And at that point, our intake services will also make recommendations for not only medication, but our co-occurring disorders groups, psychology.
Okay. Well, it's good to know what a great resource we have. Hopefully up on your screen you'll see the website where, if you'd like to watch this show with Sharon again, or if you'd like to watch some of the other shows, we want to thank you for joining us, and we'll see you next month. Sharon, again, thank you so much for coming.
You're welcome.
And
thank you for having
sharing
me.
your wisdom again this month with us. It was so nice to have you back, and it's good to know that there is help and there is hope.